Despite the rising number of positive cases of COVID-19 in the Oti region, there are no funds for surveillance and contact tracing. This development, according to the Regional Health Director, Dr. Afre, is making the fight against the pandemic difficult. There was also a rise in the number of positive cases among health workers in that region. Dr. Afre was speaking on the sidelines of the 2021 half-year Health Delivery Performance Review. Peter Senu has more in this report.
The Oti Regional Health Directorate has held its half-year performance review to assess its performance over the past 6 months at Nsuta in the Jasikan district on the theme engaging stakeholders to ensure continuity of service in the midst of COVID-19 pandemic. Various district heads presented their performances and challenges for resolution. The non-availability of adequate doctors to handle the rising number of patients still led the chart as in previous reviews, the topmost challenge against quality health delivery in the region. Accommodation challenges for even those health workers who have accepted posting to the region is also high on the radar. Other logistical challenges such as regional storage facility, regional cold room for medications, and vehicles for monitoring and supervision are also still paramount. The region has recorded increased numbers of COVID-19 positive cases in recent times, with some in education institutions. Dr. Oti Afre is the Regional Health Director. He provides some updates.
The Oti region is currently in a state with, just as the national picture depicts, with COVID. So far, cumulatively as a region, we have recorded 771 confirmed cases of COVID-19, of which about 25% of the cases are health workers, which is a source of worry, because the health workers are supposed to lead the fight against COVID. So if they themselves are getting infected, then it's quite worrisome. The region has recorded 8 deaths so far since the pandemic started in our region in March 2020. Initially, we've been able to vaccinate about 4,500 people with the AstraZeneca first dose of the vaccines. And we are happy to have received some quantities also for the second dose. And we've also received some 500 doses of Johnson & Johnson to be used for immunization of people who are not immunized.
The unavailability of funds for contact tracing and surveillance, Dr. Afre tells JoyNews, is making the fight against the virus difficult.
Obviously, we need funds to carry out a lot of activities, especially contact tracing, case management, carrying out a lot of public education, providing other support services to curtail the COVID pandemic. The funds are not adequate, and we are working around the clock to make sure that at least we get some funds for that. You know, recently we even got some school outbreaks, and it was very difficult for us to do contact tracing for them.
He also bemoaned the non-adherence to the COVID-19 protocols as another challenge, derailing efforts at combating the virus in the region. The regional minister, Joshua Makubu, urged the health workers to adhere to the very protocols they have instituted for the public, considering the rising number of cases among the health workers in the region.
Yeah, the vaccines are there, but I think there's a simple way of going around it, simply by obeying the protocols that you people have put together for us. So I expect that in your institutions, we will see strict adherence to this, especially at the time we are made aware that some health workers are affected as well.
Meanwhile, the region has taken delivery of only 500 J&J vaccines for first-timers in the region, while those taking their second dose for the AstraZeneca are doing so. My name is Peter Senu for JoyNews.